It's an end of an era in Milwaukee County. Today, County Executive David Crowley announcing the county's vaccine mandate and masking requirements have ended. The policy change comes as the federal government announcing the COVID-19 public health emergency will end on Thursday, May 11th. Joining us to talk about this and some other big health headlines today, Dr. Jeff Potoff from UW Health. He's the Chief Quality Officer. Doctor, great to see you. So we've got so many headlines, especially about the end of COVID-related things, health emergencies, mandates, even the end of data sharing. I want to ask you a question that we asked you seemingly every day at the height of the pandemic. Where do we stand in Wisconsin right now with coronavirus?
Ben, we're in a pretty good spot with coronavirus in Wisconsin. Now, it's not to say that no one gets COVID-19 anymore. It's not to say that no one ever gets hospitalized from it anymore. But, whether it's vaccine-induced or disease-induced, we have a good level of baseline immunity. We're not seeing as much severe disease. And there's less vulnerable people now because you either had COVID already or you've been vaccinated. So kind of this pullback of things that we got used to, whether it be masking or even the mandate to get vaccinated, isn't as important because there aren't as many people to protect at this point during the pandemic or maybe the end of the pandemic.
Yeah, good news in that department. Hey, I want to ask you about this big news coming out, big changes to breast cancer screenings. Health experts say women should get tested younger?
Yeah, absolutely. So why would the U.S. Preventative Health Task Force make this change? We've looked at breast cancer and who we're seeing it in. And over the last probably 5 years or so, we've seen each year a successive 2% increase in the number of women between the ages of 40 and 50 who are getting breast cancer. So historically, if you had risks, i.e. family history or something like that, people 40 to 50 would get screened. But this is a more general recommendation for women age 40 to 50 to get screened. There's some debate on how often that should happen, whether it should be annually or every other year. But certainly if you're age 40, you haven't had a mammogram, talk to your primary care doctor sometime in the near future and see if that's something that you should be getting.
I've been looking at the headlines today, and it seems there's been a concerning rise, especially for black women, when it comes with getting breast cancer and dying from it. What's the data showing?
Yeah, what we're seeing in black women is that they are in this group of individuals who get breast cancer at an earlier age, much more so than, say, white women getting breast cancer at this age. And that's one of the things that we hope to pick up when we do this screening at an earlier age, is finding more folks in a black population who maybe have these early cancers that we can detect before they get farther along in stage, easier to cure at that rate.
This has been long debated. I mean, in 2009, there was a recommendation made for this to happen, and then a task force decided not to do that. What has changed?
Yeah, I think it's this increased rate that we've seen now over the last couple of years. It's better studied, and we understand that more women between the ages of 40 and 50 are getting breast cancer than we either realized or maybe they weren't previous to that. And that's what's really driving this change is we know that there are women who are getting breast cancer in this age group, and if we act on it sooner, we can make a difference in their prognosis.
Lastly here, speaking of cancer, there's been some concerning news that there's a shortage of life-saving cancer drugs. What's going on?
Yeah, a lot of cancer centers, including Carbone Cancer Center at the UW, is looking into how we would potentially have to modify, change, use different agents for cancers that are often treated by drugs that end in platin. So cisplatin, carboplatin. The manufacturers are having a hard time keeping up with demand for these drugs, and that makes healthcare centers plan on what they need to do to treat patients if those drugs aren't available. It could be reducing doses if there's a dose range. It could be switching to a different chemotherapeutic agent. I think for general public, if you're getting treatment for cancer, you're getting a platinum drug, it'd be important to talk with your doctors to say, hey, is this something that's going to affect me? Do I have anything to worry about? Or are we okay? Currently, we haven't run out of these drugs, but they are reported to be on shortage. It could get worse in the coming months.
Yeah, how concerned are you?
I get concerned not only about these cancer drugs, but in general, in a country that has, with seemingly unlimited resources, we struggle to have the availability of medications that really help patients. And I think something needs to get looked into to make sure that we have everything that we need here in this country so we don't have shortages of these critical medications that sometimes are a nice convenience, but sometimes are the difference between life and death.
A lot of things we talked about that you can talk with your primary care physician about if you got questions about it. Dr. Jeff Potoff from UW Health, appreciate your time.
Thank you.